It's a great opportunity now for me to talk to Dr. Hedy Wald, who is visiting AMEE for the second time. It's lovely to see you again, Hedy.
It's great to see you, John. Yeah. Thrilled to be here.
Good. Tell us a bit about the background, how it came that you're a plenary speaker this year.
Well, what an honor and a privilege. Life is full of amazing events. This is one of them for me. I'm delighted that AMEE has decided that the topic of GOT resilience and integrative approach is something that they wish to highlight. And I've been working in this area, doing some talks and workshops related to resilience and well-being, sort of springboarding off my background in reflective practice and professional identity formation. So I had this invitation to kind of bring some of those, both the literature and my experiences, to help inform an international community on this vital topic.
This is a great place to come with that agenda. We're familiar, I think, with the concept of burnout in medical staff, in hospital employees, and also I believe in students as well.
Yes, the data is concerning. The good news is that we are now moving beyond burnout to a more preemptive and protective approach in thinking about how to cultivate resilience in various areas, not just in the individual, but also in the learning environment and the organization, which is what I'll be discussing in the plenary related to a more integrative approach. And I have optimism on this, that we're starting to see that this is a concern, the mental health of our healthcare force, relating both to their own well-being and impacting patient care. So we are now seeing that this is something that must be addressed.
It's interesting that that's come up the agenda, as you were saying, since 2 or 3 years ago, since we spoke last on this topic together.
Yes.
And I've come across this same need in other professions which I'm involved in with counselling, and they also are aware of this and are putting instruments in place. It'll be part of a sort of continuing development process. Do you think that is that the sort of field which will deliver the remediation that you're talking about?
Yes, I think so, and I think that the dedication to this as an integral part of what we do versus some side-on thing, that kind of commitment and dedication, because of the data that we're seeing, will make the difference, and the fact that this is a process and an outcome is also very important.
If I could be provocative, and I don't mean to be rude, but people may perceive this as a rather peripheral part of professional life and therefore not quite so real. And I guess you have arguments against that.
So one of the things I'm going to touch upon in the plenary actually is that the accrediting bodies currently are calling this an actual requirement within the training, that this is core to professionalism. It's actually a professional responsibility and an ethical imperative because of the data coming out that lack of wellness can impact patient safety. And when we talk about not only our own well-being, but that of our patients, then we're in another place. So this is actually, I would argue, that the data has now brought us to a place to say that this is part of our professionalism. This is part of our education, both at undergraduate, graduate, and even into continuing medical education as a lifelong process, and also core to our professional identity formation.
And you've been passionate in highlighting it and bringing it to our attention, and that's very important and relevant.
Sure.
I read these posters downstairs, 2 poster presentations about burnout in students. They were quoting 50% in their cohort.
Yes.
That's a huge amount of people.
Yes, it is. And I think one of the things that we're trying to think about is it's not only burnout, it may be features of burnout, it may be actual depression. How do we think about crafting a learning climate and perhaps some mentoring early on so that we can have a realistic view on what is stress, what is manageable stress, what is stress that we might be able to reduce, and how might we help our learners to better recognize signs of stress and manage it and decrease it over time. So I think it's going to be kind of a multi-dimensional approach.
So from what you're saying then, there's a sort of self-help aspect to this. We can help our students to help themselves, as well as have resources with which we can supply help to them.
Yes, but I would say also that we as educators need to be looking at our own resilience and well-being, because that impacts our learners. If we bring a level of cynicism, this will increase their stress. So we need to be thinking about this not only for our learners, but for our clinicians and our educators. I see this as a joined community, basically, of practice that includes our own resilience and well-being.
Yeah. What an absolutely worthwhile topic to be speaking about. Yeah.
Indeed.
How would you think your message will get across? This is a huge conference this year, 3,500 or more people, 102 countries.
How exciting is that?
Yeah. And it's a multi-healthcare, multi-professional conference. How do you think your message will get over? Do you think you're getting there with this message?
I have to tell you, just with some informal curriculum discussions in the hallways, and folks that have come up to me to say, I'll be there Tuesday at 8:30. There is a real interest in this in a very dynamic way, and I'm very encouraged by that. This cuts across the professions,
of course,
and it's touching all of us in various ways. So people are very interested in what are more protective approaches to get in there, and I really don't want to hear about burnout as the end result. Let's get in there ahead of time and make sure that we don't get there.
So I'm sure there's a lot which we can learn and take away and look at ourselves and our own professional environment,
I hope
isn't there?
so, I do. I feel that I would like to help this learning community to live the questions, to develop the questions for themselves and their organizations, and to think about, with the literature and my lived experience, what can they perhaps take back and start to make some changes that are real and make a difference.
So some take-home messages from here, for sure. What resources would I be able to tap into back home if I was trying to answer these questions?
Well, I think having some meaningful conversations within our educator community and our organization systems will be very helpful, perhaps with some of the literature that I'm citing. I'm also going to tell the community that at the end of my slides, what they can access online, there are 3 slides filled with references so that they can gain more information and learn a bit more and see how this could be implemented within their own organizations, and to be thinking about some of the systematic reviews out there that are looking at actual interventions that have made a difference and can cultivate resilience and well-being.
So as well as you're being broadcast live online, of course, when your plenary comes up, but it's also be archived, so it's available on the AMEE website for people to look after.
And we're all learning together, and I'm a lifelong learning person as well, so I feel like there will be plenty of give and take, and perhaps sow the seeds so that we can have future conversations as people leave AMEE and go back to their institutions.
And of course we can tap in questions from AMEE Live online by hashtag AMEE 2018 and get other questions from around the world as well. I'm sure you'll be able to answer them all very well.
I hope so. I do.
Yeah, sure.
Yes.
Thank you very much, Hedy. Lovely to speak to you again.
Thank you. Same here. And appreciate your time.
Don't forget, hashtag AMEE 2018 if you want to ask live questions to any of the plenary speakers as they come up. Thank you.